And together, we will move mountains. And if they don't hear our message, then we'll just do it over and over and over and over 1,000 times again for you.
And I'll rise up, I'll rise like the day, I'll rise up in spite of you. I will rise, we will rise, we will rise, we will rise.
Hello, my name is Michelle Zabel, and I'm an assistant dean at the University of Maryland School of Social Work and the proud director of the Institute for Innovation and Implementation. So this year of working virtually has necessitated some really creative approaches to conferences. For us, we've spread the Training Institute workshops over the last 9 months, hosting just a few workshops each month. And I want to thank you for joining in these discussions and participating each month. This summer, we're continuing the Training Institutes in a way that will allow you to take us wherever you go. And I am hopeful that you are able to take a break and get away safely. We're going to be recording our summer workshops and releasing them each month so you can watch them anytime during the month that works for you. These workshops are going to be on a wide range of topics, all focused around strengthening your skills as you support children, youth, and families. A quick note, some presentation reference information and graphics that are embedded within the presentations may not be fully explained within the audio, but all of the presentations are accessible to download, as well as the resources and handouts that correspond to each workshop, and I encourage you to do that. Thank you for listening to the audio recordings of our summer workshops for Training Institutes Live. While you're enjoying these summer months and workshops, we'll be planning and working towards future Training Institutes when hopefully we can all see each other in person. Take care, enjoy your summer. Thanks.
Welcome everyone to today's Training Institute's live workshop, supporting the growth of the parent peer support workforce, training and implementation standards. My name is Millie Sweeney, and I serve as the Deputy Director for FREDLA, the family-run Executive Director Leadership Association. FREDLA is an association of family-run organizations across the nation, and all of FREDLA staff are parents of children and youth with emotional and behavioral challenges. Our mission is to support family leadership and promote family-driven policy and practice nationally. We're also a partner in National Technical Assistance Centers to offer support, training, and technical assistance in the areas of family engagement, family-driven care, parent peer support, and more. Co-presenting today are colleagues from Ohio and Pennsylvania, an amazing group of presenters with a wealth of knowledge, experience, and commitment to parent peer support as a critical part of the service array for children, youth, and families. Wanda Cummings is the Family Peer Support Specialist Training Coordinator from the Youth and Family Training Institute at the University of Pittsburgh. And she's been involved in parent peer support for many years in various positions. As a parent herself, Wanda brings both personal and professional experience to her work statewide and nationally. Randi Bargo-Smith and Wren Hawkins join us from Union County in Ohio, where they are part of a county system of care site, as well as statewide efforts in training and growing the parent peer support workforce. Randi is the project director, and Wren serves as the lead family contact, as well as the coordinator for the parent peer support provider and supervisor training. Today's workshop will focus on standards for parent peer support, starting with the purpose of having both training and implementation standards, and then identifying strategies for both establishing standards and providing ongoing support for this workforce and their supervisors. You'll learn how this is happening from the national, state, and county perspectives. Let's start with some basic information about this unique workforce. Although they may be called by different titles, parent peer support providers are caregivers who are hired based on their lived experience caring for a child or youth with emotional or behavioral challenges, and in navigating the various child-serving systems to access services and supports for their families. This experience is the core of parent peer support and is the main qualification to be a parent peer support provider. Many PPSPs also have degrees, but it is the lived experience that a parent peer support provider uses in a professional manner with other caregivers and their families that is key. Peer-to-peer support facilitates connection to services and supports, retention in those services, and parent peer support providers model advocacy and collaboration skills for both parents and other professionals along the way. They fulfill a variety of roles, infusing family voice at all levels of service delivery and system operations. Parent peer support is not the same as adult peer support, or really youth peer support. While the need for confidentiality, ethical behavior, and a basic knowledge of mental health is necessary for both, their daily work, the needs that they address, the situations encountered are significantly different. They're not the same type of service or workforce, and each has their own set of competencies, skills, and training needs. Adult peer support is characterized by lived experience as a consumer of mental and behavioral health services, and it's a relationship of mutuality. The focus is on the individual as an independent consumer who's living in recovery. The focus is on the adult mental health and physical health symptoms, on vocational goals, housing, and sometimes the adult court system. Parent or family peer support, as it's sometimes called, is differentiated from adult or youth peer support in that the support is provided to the caregivers rather than to the children who are experiencing behavioral health challenges. A PPS provider has received specific training on using their own experiences to inform, support, and guide other caregivers and families. They assist parents in navigating child-serving systems and sometimes the adult system as well. Another differentiating factor is that parent peer support is oriented to building resiliency rather than recovery. SAMHSA defines resilience as an individual's ability to cope with adversity and adapt to challenges or change. Resilience develops over time and gives an individual the capacity not only to cope with life's challenges, but also to be better prepared for that next stressful situation. Optimism and the ability to remain hopeful are essential to resilience and the process of recovery. Increasing resiliency skills and promoting protective factors are integral to children and youth becoming adults that are not affected by their experiences with emotional, behavioral, including substance use, or mental health symptoms or disorders. And finally, parent or family peer support providers work with the whole family, often addressing the needs of more than one child or the medical or behavioral health needs of the parents themselves. Often a parent peer support provider may assist the family with stable housing, with employment or other healthcare issues. Thus, their training and supervision needs are different than those of adult peer support providers, although there are a few common training areas such as confidentiality and documentation that they do share. Parent peer support providers offer a variety of supports. Listed here on the slide are the basic scope of activities, and those include providing empathic listening and emotional support, helping families navigate systems, and supplying information about those systems, about behavioral health and development, and connecting them with community resources, providing advocacy support that provides those win-win solutions that are better for everyone, and encouraging partnership that protects the family and provider relationship. They encourage self-care activities, and they also facilitate engagement with service providers with the family. They model collaboration between families and professionals around that shared goal of improved outcomes for the children in the family. They engage in safety and care planning. They explore and eliminate barriers to care plan follow-through, and they offer a variety of skill building for parents that enhance resiliency, communication, advocacy, and all the other areas that affect the ability to maintain their child who may have complex needs at home, at school, and in the community. Now, this caregiver to caregiver support is provided in a lot of different settings. It's important to note that parent-peer support is not a clinical service. It's complementary to other services, enhancing the work of the family and other providers on the family's team. A parent-peer support provider serves the whole family, is community-based, and meets the family where they are, physically, emotionally, and logistically. Parent-peer support is strength-based rather than deficit-based, helping the family to identify their strengths and use those to address needs and to build resilience. This unique peer workforce has been steadily growing as a response to gaps and needs across the nation, such as geographic challenges that affect treatment options and access, concerns over participation in treatment and service plans, recidivism that's associated with some traditional approaches, family voice and choice, and the need for skill building. Now, again, this is not a clinical service, and it doesn't replace traditional mental health services, but it is complementary to other services, enhancing the work of everyone involved. Parent-peer support providers strengthen families by enhancing the family's abilities, capacity, and skill sets, by providing support, training and building bridges between families and providers, and enhancing that resiliency that we talked about earlier. Parent-peer support is a critical service that can be provided within any child-serving system as a standalone service, not just as an enhancement to other service models such as wraparound. Traditionally, parent-peer support has been funded through grants and foundation monies, but that's really changing to more diversified funding. There are now 30 states with Medicaid billing for parent-peer support, and this continues to expand. There is funding available for levels of parent-peer support in every child-serving system. It's a matter of building relationships and leveraging that funding to build parent-peer support programming in your area. The graphic on the slide now outlines the potential roles of parent-peer support providers across the range of service intensity levels. Parent-peer support providers can be and are part of all levels of service delivery, from the least intense services, as you see to the left of your screen, such as education, information, and referral, to the most intense, which is all the way to the far right of your screen, inpatient or residential treatment, and intensive in-home services. Although the title and responsibilities may be different for each role, the core competencies and the parent-to-parent approach is consistent. The way in which this workforce is employed is also evolving. Historically, parent-peer support providers have been employed mainly by family-run organizations. And although those family-run organizations, or FROs, remain the largest employer, parent-peer support providers are now found in governmental agencies, managed care organizations, private health providers, and across child-serving systems through a blended model, such as child welfare and juvenile justice. This graphic is also available for download in the resources that follow the slides, showing how the different models of parent-peer support are applied in communities across the nation. With ongoing expansion of parent-peer support roles and programming, there's also an increasing variety in how this service is provided. Although there is a national set of core competencies, states often establish their own competency areas. Certification and required training also vary from state to state, as do the models for implementation. So currently, there is no competency-based standard for the practice of parent-peer support. As a profession, it's important that we have standards in the basic practice of parent-peer support. Its most effective standards are competency-based. And what are competencies? Those are the characteristics that a parent-peer support provider should demonstrate that indicates readiness to perform and function independently in this particular practice. They include more than facts. Competencies represent the integration and application of learned facts, skills, and effective qualities needed to serve families, systems, and the profession as a whole. As parent-peer support providers fulfill many roles across multiple settings in a community or state, It's important to have a basic level of competency that all parent peer support providers must demonstrate and then build upon for their particular roles and responsibilities and positions. As parent peer support expands, parent peer support providers fill roles, and they are across multiple settings. It's critical that there is a foundational set of competencies that are expected for this workforce. In this way, there's shared knowledge and an understanding of the basic role and responsibilities. The competency-based model is an innovative approach to determining the optimum combination of skills and behaviors that are required for a particular position. And the result is strengthened human resources practices in your organization. It can be improved organizational effectiveness and streamlined costs, better satisfaction in your job, and increased productivity, and ultimately leads to better outcomes for children and families, which is our goal. State, national, and international organizations have created core competencies for peer support. Whatever core competencies your state chooses, however, how you train, assess, support, and coach your parent peer support providers to these core competencies is what will determine your success. This is also true for supervisors of this workforce, as it takes certain skills to support a workforce that is tasked with using their own personal experiences in a very professional way. Implementing competency-based practices involves these three basic steps. First, you must decide on the competencies. You can choose an existing set and the associated trainings that are applicable, or adapt an existing competency-based training to fit your state, or you can create something new based on the data from your state and what's needed there. Following training, you need to assess for mastery of those competencies. This is done through testing, written or even oral testing, a process of shadowing a parent peer support provider to assess implementation of skills, or perhaps even a probationary period with regular assessment points for mastery. Ongoing support, coaching, and supervising ensure effective implementation long-term. And both parent peer support providers and their supervisors benefit from having competency-based training and support in fulfilling their roles effectively. Now, quickly, I wanted to give you a national overview of the trends in certification and training, how this is being implemented in various states. Certification usually occurs in one of these three ways. The National Peer Support Provider Certification, which is through the National Federation of Families, or the state has a certification process, and then they also require that national parent peer support exam, or the state certification is developed completely internally to the state. There are a number of parent peer support curricula available for purchase from family-run organizations or individual developers. Sometimes a state, county, or organization will purchase the training as well as coaching for use as the required training for their certification in that state. Some states have developed their own training, usually by partnering with a family-run organization who has the expertise in this area, or they have opted for a combination of purchased and state-developed curricula. As your state contemplates the best route for competency-based practices for parent peer support, these are the best practices for this workforce that should be considered. These are necessary minimum components in best practice. So for certification, that includes lived experience as the primary caregiver of a child with emotional, behavioral, or mental health challenges, a defined set of competencies and a scope of activities, defined certification and recertification processes, required training on those core competencies, and then an assessment of competency. Usually it's a test or an exam. Required ongoing professional development in those core areas. That's usually a specific number of hours per year of professional development and training. And supervision. Could be a peer with access to clinical consultation. We'll talk about that next as best practice. Many states require a master's level supervisor, however, for a number of reasons. And then a high school or GED for the person who's going to be a parent peer support provider. That's required for billing Medicaid, but there are a lot of other ways to fund it that do not require an educational level at a minimum. Necessary minimum components for a competency-based curriculum for parent peer support providers should include these things: sharing your story effectively and strategically, system navigation, especially the education system that all of our children must go through, confidentiality, ethics and boundaries, being an effective advocate, being assertive and not aggressive in your advocacy, facilitation and developing collaborative relationships, goal setting and action plans, documentation, and of course, self-care. And establishing standards for the practice of parent peer support in your state or your area, it's of critical importance to ensure that the organization, the supervisor, and the parent peer support provider themselves are ready. Interviewing and hiring processes should assess readiness of the individual to do this work. Are they far enough along in their journey to be objective in supporting another family in similar situations and in the same systems, sometimes with the same providers that the individual navigated or is navigating themselves? Having supportive supervision should be in place. Supervisors who really understand the nature of this work and are able to champion parent peer support, both within and outside their agency. Organizations employing those with lived experience should examine and refine their policies and procedures to be supportive of this workforce, ensuring that there are clear job descriptions, there's clear programmatic processes, and that there's a plan for sustaining this programming and having ongoing professional development of the staff. Readiness is the key to implementation. We've discussed the importance of establishing standards for parent peer support providers, but it's also incumbent upon us to do the same for their supervisors. Having a supportive supervisor who understands and champions the role of the parent peer support provider is critical for hiring, training, supervising, and retaining this workforce. Although there are no national competency-based standards for supervision, there's a few curricula available to assist in establishing standards in your organization or state, as well as decades of best practices that have been learned through the experience of family-run organizations. Parent peer support began with family-run organizations, and they are an amazing source in helping you develop effective supervision processes and support in your state. Since there are no national standards, let's quickly go through some best practices in supervision of this unique workforce. There are many ways to structure supervision: individual, group, co-supervision. All formats have their merits, and it really depends on your state or agency's approach. For parent peer support providers, best practice is peer supervision with access to clinical consultation on a regular basis. Now that we've talked a little bit about national trends and best practices and standards for this workforce, let's hear directly from those who are implementing this in the field. We'll first hear about Pennsylvania's experience, followed by Ohio. So I'm going to turn this over to Wanda to share what Pennsylvania has learned. Wanda?
Okay. Hi, my name is Wanda Cummings. I'm the training coordinator for Family Peer in the state of Pennsylvania. I'll be talking about setting standards for Pennsylvania Family Peer Specialists and their supervisors. Family peer support in Pennsylvania. We've had many starts and stops along the road finalizing family peer support in the state of Pennsylvania. The statewide initiative for competency training started under statewide and Philadelphia System of Care grants in 2017. So I want to kind of skip ahead to 2017 and talk about the positive aspects of what we've done within the state. The standards are defined that we'll be using through the Office of Mental Health and Substance Abuse. And with that, to build on that, we have a work group that's been identified that drafted standards for certification, and they're presently under review. Going back to 2017, once we were able to get funding for state grants to do training, FREDLA was recruited. And in that process, FREDLA was able to provide the parent peer support practice model of training for many Pennsylvania peers and Pennsylvania supervisors. In addition to the FREDLA's training for peers and supervisors, they also offered an opportunity for peers, family peers, to be trained as trainers. Within that process, I was actually afforded the opportunity to be one of the trainers, to learn to be a trainer, and that is my dream job at this point in my life. One of the things that Philadelphia and Pennsylvania decided to do was build upon the standards that was put in place by the Office of Mental Health and Substance Abuse Services. So they drafted an outline of what it would look like when we would finally get some type of billing processes. Continuing on with the Pennsylvania standards for family peer support, I neglected to mention that most of the states call it PPS. Pennsylvania and surrounding areas of Philadelphia decided to name it family peer support in an effort to cover everyone that's caring for children, youth, and young adults. What is happening a lot in our area, especially the more urban areas, we have more family members that are taking care of children than we have parents. So we wanted to make it inclusive for everyone that's involved with the process. And the decision became, let's make it family peer support specialist instead of parent peer support specialist. And that seemed to work for Pennsylvania. The family peer practice model was coordinated by statewide and Youth and Family Training Institute, one of the institutes that I'm presently working for. And we also have workforce training for high fidelity wraparound. All of our trainers in the state of Pennsylvania were credentialed by FREDLA, and we're all working in various family organizations across the state of Pennsylvania. To date, we've trained over 200 family peer support specialists, and that's been since 2017. Over the last few years, it's been a larger number of people stepping up and really buying into family peer support and wanting to be a part of the processes. All trainees must be family members and primary caretakers of a youth or child or young adult. And we stress one point that FREDLA has taught us, and that's that family peers are equal members of all professional workforce. Training for the supervisors, the family peers criteria has a certain set of criteria that you have to be a family member, parent, taking care of a child, youth, or young adult with emotional, behavioral, or co-occurring disorders. Family peer supervisors have a different set of standards. We like to engage supervisors that are empathetic and caring and that have supervisor experience, but also have that extra piece where they'll be understanding and supportive and also champions for the family peers in their organizations and go out and do the same for providers and the child serving systems and the communities that they're involved in. Family peer specialist supervisors are to promote professional and personal growth in their family peers, ensure that they comply with ethical, professional, and legal standards, and support them in self-care. Self-care has been a very, very important aspect of family peers, and the family peer supervisors play an intricate role with that, with making sure their environment and everything that they utilize, the tools and the support they provide will be a constant reminder for peers to know that self-care is an important part of their job. So I think, and with that, supervisors have created environments that they can frequently praise and celebrate the successes and also encourage their family peers to look at opportunities for growth. No one has to stay at the starting point. You can come in and at one position and move up the ladder if that's so your desire. It's important to remember that one of the key elements for family peer support supervision is to create that supportive environment all throughout the job role and make sure family peers' roles are clearly understood and valued. Supervision should create environments that challenges the peers to always look for solutions to issues, always, pushing themselves to the limit as far as reaching out to support other families, using what they brought into the program with their lived experience, along with learning more training and tools and how to just hone their skills. Using strength-based feedback at all times, it's important that you're talking to people in a manner that make them want to be motivated to do more, setting professional goals, promoting continuing education. There's always more to learn and more to give. Model and instill independence. You want to have high expectations for your peers to make sure that they're in a position where they can do the work and also can handle accountability for whatever role they're playing. Of course, in any new found program process, you're going to have some trial, failures, successes. It's more trial and error, but I would like to say that at this point, we're on the success side, which is like very positive. What we've learned is that it's important for ongoing training, and support is critical for this workforce. Establishing standards require buy-in and through many stakeholders, and that takes time. Everyone is not going to initially jump on board and be welcoming of family peers coming in doing work that most people feel that is for professionals to handle. Supervisors need training and support to effectively supervise the people that use their lived experience in professional roles. Having that supportive supervisor is vital to the success in these roles. As of 2020, when COVID kind of entered in everyone's life and changed the dynamics of how we interact with each other, we decided to partner with FREDLA to put together a virtual training. And that was developed in a few months. We started using that, and we have positive, very positive feedback from that. Even from people that would normally go out to in-person trainings, I've had providers and agencies and peers alike say that they love the fact that they can do it virtually because they're able to work from home or continue to manage whatever is going on with their child. With a lot of children being home from school and working virtual, it just happened to really pair up and be the perfect opportunity. It also have given opportunity for more trainings, although they're smaller, because you want to make sure you still have that individualized touch for everybody. You can do more trainings because people are not traveling. You don't have the process of people coming in and out. You just pretty much set it up, get the material out for everyone, and the trainings can be ongoing. Right now, we're doing monthly trainings. We also, to continue all the support for peers and ongoing resources and support, we do monthly peer-to-peer support groups, ongoing trainings in topics such as wellness, communication skills, boundaries, and ethics. And in preparation for one day, Pennsylvania is optimistic that will eventually be a billable service. We continue to train the peers to be prepared for that. I think one of the trainings and the monthly professional development that we're particularly proud of is with the School District of Philadelphia. Our school district have many peers in the schools throughout the city, and it's been very helpful for families. It's been a godsend for some that do not have great relationships with the school. It's building so many avenues where families may need support outside of schools, and the family peers have had some of these issues themselves with children attending the public schools in the area, and they can learn from that. They teach them how they navigated the systems, and with that, every month they're able to come back with their ideas and share them with each other. And also we bring in speakers that have professional skills in certain areas in the child serving systems to support the peers. And this have really built up the whole family peer community in the state of Pennsylvania. With that, I would wrap up by saying overall, what we've learned is family peers are a dynamic, incredible group of individuals that never give up, because we've had many challenges, but no one gave up. They kept pushing through. And notice that at the end, these are people, including myself, who see a challenge as an opportunity. Instead of backing away from it, we look at ways that we can work together with agencies, providers, and families and make this work for all of our families in the state of Pennsylvania. So it's been a positive experience, and I look forward to continuing the process. Thank you. I'm going to turn it over now to Ohio.
Thank you so much, Wanda. Randi Bargo-Smith, the Youth Systems of Care Director at the Mental Health and Recovery Board of Union County. Myself and my colleague, Wren, are really excited to be with you today to talk a little bit about the work that is happening in Ohio. Because not all states have alcohol, drug, and mental health boards, I really wanted to quickly orient you to our role within the community. So as the Mental Health and Recovery Board of Union County, our role is to assess the behavioral health needs of our entire community on an ongoing basis, fund and support the needed services, so we don't actually provide the direct services, and ensure that the services are appropriate, accessible, available, and affordable for all members of our community. We wanted to give you a little bit of background on our community. So we really consider ourselves a small but mighty county and board. We have a population that's close to 60,000 people with around 13,000 youth, but we are currently the fastest growing county in Ohio. So there are some projections that estimate that our county is projected to grow by 35,000 more people over the next 30 years. So we really consider that a great opportunity. Our executive director is very visionary, our leadership is very visionary, and we really pride ourselves on being innovative and forward thinking. So like so many of you doing work within your communities, we really care about the people in our county, and we want to provide the best services as possible to lead to the best outcomes for all of our youth and all of our families. So as a part of that, we were really thrilled to be awarded a $4 million 4-year SAMHSA Youth System of Care grant in 2019. So we really wanted to focus on establishing a system of care infrastructure, community health, increasing evidence-based services within our community, increasing the use of natural and recovery supports, preventing mental health and substance use challenges, and being able to really promote wellness. Looking at ways to increase protective factors and strengths-based practices, identifying and removing barriers to access and engagement and awareness of our services. So we really wanted to look at our youth community as a whole and identify what are some of those populations that we really need to focus on. So that included some of our multi-system youth, our youth who identify as part of the LGBTQIA+ community, youth with severe emotional disturbance, and really all of our youth and families, because all of them can benefit from wellness promotion, information referral, prevention, and increased natural support. So we're really working as a team and a community to fill any gaps across the entire Institute of Medicine's continuum. And one of our primary goals is to really make it easy for families in our county to access wellness services and support. And I'm going to pass it off to my colleague, Wren.
Hi, everyone. I'm Wren Hawkins. I'm the lead family coordinator here at the Mental Health and Recovery Board of Union County in Ohio. I was brought on as the lead family coordinator to inject family voice and choice into the programs for our families in Union County. As Randi mentioned, our youth system of care grant that came to us through SAMHSA, and all the initiatives that we hoped to bring to our families. One of the initiatives that was on the list was parent peer support, but it was kind of low on the list. We didn't really know what it was, what we were going to do with it, and how we were going to implement it. So as a person who was new to the industry, that was one of my first goals. I am a parent with lived experience. I was a stay-at-home mom for 15 years, and I was fighting for my kiddo. As I was fighting for my kiddo, the board wanted to bring me on to be the family voice for everyone's kiddo. So that's when I started here. Just to give you background on my lack of knowledge when I walked into the position that I'm in right now. When we needed to look up parent peer support and how to implement it, that took a lot of time and a lot of work. Mostly because of some inconsistencies. So as I was doing my research, looking through the state of Ohio and looking through the national level for training models that we could make our own around, I found a lot of inconsistencies around job titles and descriptions. As we discussed already, there are so many different names for this position: family, parent, navigator, partner, support professional, and job descriptions as well. There are some parent peer support providers are on the information and referral spectrum, and some go all the way up to the crisis and emergency room needs. So those descriptions were way over all over the board as well. There was a lack or inconsistency of training models. We know that the National Federation of Families has a certification on a national level. We were very aware of that and thought maybe we could use that. We also know that there are family-run organizations and boards that have some of these as well, some of the training models as well. So just large and small, all different types of training models. And then, of course, the inconsistencies in the certification process. Again, the National Federation of Family for Children's Mental Health, there is a national certification process in place, and there are a few state levels in place, but that's still an ongoing work in progress. So after I had been looking and looking and looking for about 4 or 5 months, we ended up asking we were part of the TA network, and our consultant from the TA network had mentioned, have you ever heard of FREDLA? And of course, I had never heard of any of this. So FREDLA came along and we had a consultation with them. We spoke with Millie and her colleague, and we started doing some readiness and assessment planning with them to see if this would be a good fit for us and a good fit for them. So in June of 2020, FREDLA and Union County, that partnership began. So through this partnership, the Mental Health and Recovery Board of Union County has become the Ohio license holder for FREDLA's National Parent Peer Support Practice Model. That includes the provider training, and it also includes the supervisor training. The practice model is a competency-based training and set to be one of the 2 approved curricula for Ohio Family Peer Support Certification. Now, we're going to hear a little bit about that a little bit later, but like we said, it is likely to be one of the training certifications, it's likely to be one of the training curricula used in the state of Ohio for the support certification. I am the state coordinator, the Ohio state coordinator for the FREDLA practice model. And like I have the same position that Wanda does in Pennsylvania. We coordinate the trainers and we coordinate the trainings. We do all things FREDLA in Ohio. That included that had a lot of work, took a lot of work. We have trained up, we have 7.5, I know that sounds odd, but we do have 7.5 trainers, someone that only does one of our curriculum. We had to take the curriculums we had to take each curriculum once, and then we went through them again as if we were trainers and how to actually do that. That was a long time. It was a very intense training. During that time, during our credentialing period, which is about a year, we also have to we have to train this curriculum twice for the providers and twice for the supervisors. That just and then 12 months of coaching and some cadre calls as well. That just lets you know how intense and how thorough they like to have their trainers trained for this training, lots of training. This is what the training looks like here. The FREDLA practice model training looks like here in Ohio and all over anyone that would happen to use their curriculum. The provider training is a 40-hour training, works out to be about 5 days. We can do in-person, virtual, and hybrid options. And then it says there's assessment to be completed. That is something we are actually currently right now in the process of getting set up. So it is in the process, but that's what will eventually be in place. Then there's the supervisor training, which is 3 days and also has the in-person, virtual, and hybrid options. So lots of different ways to do this, lots of different ways to bring this out to the to the world. So because of all these inconsistencies I found, because of the newness of this workforce, and because we're trying to let this community know that this is an actual legitimate workforce. So the first thing that we need to set standards for is around training. As states adopt the certification standards for parent-peer support, this will come because there will need to be trainings that are approved for those actual certification standards. So this will kind of take care of itself through that process. There's competency standards. Those fall in line with our core competencies, like Millie was mentioning earlier, and the code of ethics that is very important for this group of people to follow. The next thing that needs to be consistent are trainer standards. If we're all of our trainers are inconsistent, they're going to teach a different model and it's going to look different. So we have to make sure that the trainers are taught standard across the state. There's programmatic standards, which is probably one of the biggest standards that we need to keep in place. This role can look very different. Not only, like I said, can it be in service intensity from low service to critical service, it can also be housed in different places. It can be housed in schools. It can be housed in our multi-system use, any of those child serving systems. That can be housed in mental and behavioral health providers. So within those providers, it can still be housed and look different. So it's just, it can morph into so many positions, so many wonderful positions, but they just look different. And then, of course, there's the certification piece. And as of right now, that's in the works in Ohio, so which is a great thing. We're not quite there yet. We're about, I want to say 3 years behind Pennsylvania, which isn't a bad thing. It just means that we're ramping up for it and getting it done. So after all of these, we get all these standards right, we need to, how are we going to grow this workforce and how are we going to support this workforce? So one of the biggest things is buy-in from stakeholders. We have to get everyone involved that could possibly benefit from this resource. Hospitals, schools, child services, mental behavioral health partners, like I mentioned, so many different places, or it could be a combination of all of them. You could have one parent-peer support provider for all of the schools in your school district. So it could really look different. And so having all those key stakeholders in the room together can let them know that maybe they can all work together to make this happen. Then you need to talk about the sustainability piece. As this workforce becomes billable to Medicaid, which it is slowly doing across the states, I think we all need to, in this field, need to keep in mind that Medicaid is just a portion of what pays for this particular position. There will always be a need for extra funding, and it won't always come from a national grant. It won't always be money that trickles in. It may be money that you have to go out and look for. That will speak to the passion of these people, because they will go out and tell you how this has helped. So that's the sustainability piece. And then the recognition of the broad use of the role. And I'm going to go to the next slide. And I know that Millie already used this slide. This is the slide of where the parent-peer supporters can be found and what level of service intensity they can be found in. And I just want everyone, you'll get this graphic, but I just want everyone to see where these roles can be. They can be anywhere. They can, like I said, you can have a parent-peer supporter that works 9 to 5 in the least intensity. You can have a parent-peer supporter that works 24 hours a day on call. It can just look so different, which is super exciting, but it can be a challenge as well. So lessons learned. one of the positive pieces that we learned is this workforce is passionate. When you make them have lived experience as a requirement, when you fight for your kid, you become a mama and a papa bear. You are in there, you are in it to win it with these people. So that's a super huge factor that helps this workforce. So, and I can't say enough about our trainers, them being positive too, because as we can amp up and we can get excited, we're going to get everybody else excited. And that's our job as being advocates and champions for this parent-peer support provider workforce. We've had an amazing, in Union County, we've had an amazing collaborative effort among all of our partners, where we work very well with our schools, we work very well with our providers. We have been blessed to bring this product to them. Like I said, be excited about it and have them be excited about it as well. And like at the last point, there's excitement about this program. Not only are the providers excited about this program, but so are, like, when I go out in the community and I talk to parents about this, they're so excited and they can't wait to start doing this. They can't wait to get that service, even if it's just someone to say, I'm with you, I get it. Or if it's someone to say, I'm gonna go sleep in the hospital with my kiddo for the night, can you bring me dinner? You know, there's so many different ways, and the parents are so excited about that. When your kiddo is in crisis, you are lost. This is critical for them. So let me go back to the fourth point there. We have a supervisor training. First of all, how many places have just a supervisor training? Second of all, it just teaches you how to manage this workforce. It's a very different management style, and you have to really think about different things. There's days where my kid has 2 therapy appointments in one day. If I didn't have a boss as great as she is, who said, I get it, I understand, you know, that's part of this whole process. So in the last column, these are the opportunities or the things that we could probably work on. Obviously, educating people on the importance of this position. So marketing this position, really. Recruitment, as we all know right now, the lack of workforce in general is a challenge. But actually finding this workforce can be a challenge too. It may be a stay-at-home mom who doesn't recognize their value. It could be someone in behavioral health who wants to switch from being in a provider to another position. So we just have to think outside of the box when it comes to recruitment. Also, this is a brand new position. It's completely new. It's not like we're taking the accounting position and making it the accounting pro position. We're not doing that. This is a new position. So finding money in places that are already strapped for cash sometimes, that's a huge challenge. And as we're talking about creating job standards and structure, that's been a challenge. And that the process at this point is still evolving. It evolves literally second to second, minute to minute. We never know what might happen. Sometimes it's wonderful, sometimes it's not, but it's evolving. So we have to roll with the punches. I'm going to pass this back to my colleague, Randi. She's going to talk to you a little bit about the certification process and more stuff.
Thanks, Wren. And I really can't say enough about the value of having a family member with lived experience in the role of leading this work. Wren has just done a phenomenal job with bringing this curriculum and bringing these trainings to our county to ensure that our folks are being trained with a quality product and are really ready to serve our families. So that's really where our work with parent-peer support has kind of been two-pronged in the approach. So Wren talked a little bit about the work that we did with bringing this training to our county in particular, and the opportunity to kind of train throughout the state as well. But the second portion of the work that we have been doing is around the development of a state certification process for family peer support specialists. So we had this relationship with FREDLA through wanting to bring that curriculum and those trainings and becoming that Ohio license holder for the FREDLA curriculum. But then at the request of our Ohio Mental Health and Addiction Services, we engaged in an additional contract with FREDLA with the goal to facilitate 3 separate stakeholder processes in order to create draft certification manuals for adult, parent, and youth and young adult peer support. So this was so critical because we know each of these peer support services are very different, but it is a very important and innovative approach to create a streamlined process throughout the state across all 3 types of peer support that all include those standards of excellence. So this was so important in Ohio because we currently have an adult peer recovery supporter certification, but we do not have a certification process for youth and young adult peer support or a family or parent peer support. So we really wanted to create consistency across all 3, but also that consistency in order to have the opportunity to support the growth of our workforce. So we wanted to make sure that the valuable lived experience and work experience of our youth and young adult peer supporters wasn't lost once they, moved on from that role, that they would have the opportunity to move into the role of an adult recovery supporter or a family peer support specialist in the future. So the consistent standards and format and process across all 3 types of these peer supports throughout the state would make all of these things possible. So I really cannot emphasize enough what a collaborative effort all of this work has been. So the 3 diverse stakeholder groups were comprised of people actually doing peer support work from many different organizations, different counties across the state. So for each of the 3 stakeholder groups, we met bi-weekly for at least an hour and a half from January through the end of April. So that's a big time commitment when you're thinking about asking all of these professionals across the state to come together and to really work to develop these draft manuals. And, we felt so privileged to be able to lead this work and to have FREDLA working with us on us to be able to bring this to our state. So the amount of commitment, effort, and hard work that folks contributed throughout this process was truly astounding. And really we learned throughout this process that it's amazing what can happen when you bring a group of passionate, knowledgeable, and experienced folks to the table together with a plan and a great facilitator to keep everyone on track. So as a group, through dialogue, teamwork, working toward consensus, we truly built the recommended certification manuals from start to finish and piece by piece. So this included a lot of those things that Millie talked about, from the purpose and the structure to definition and position titles, from core competencies to the scopes of activities, supervision and employer responsibilities. We built the code of ethics for each of these certification processes, the eligibility and certification process, renewal processes. We talked about and made plans for changes in certification status. Created a complaint and grievance procedure. And then we also created all of the necessary appendices for the certification manual. So this really allowed us to create these comprehensive manuals that could just be handed over as recommended draft certification manuals to the Ohio Department of Mental Health and Addiction Services. So we were able to hand over these completed documents right to the Ohio Department of Mental Health and Addiction Services. And then we were able to bring each of these groups together to present the draft manuals to an internal committee on peer support. So that happened at the very end of April of this year. And then our stakeholder groups are going to reconvene in July with members of those state internal committees to really engage in dialogue around what are in these manuals, concerns that they might have, and plans to move this work forward throughout the state. So we're really, really hopeful that these recommended manuals will result in state certification processes for family peer support, adult peer support, and youth and young adult peer support. And we just feel so thankful to have such a commitment and buy-in from all of these folks throughout our state that are doing this important work and have that expertise. So when we think about lessons learned throughout this process, especially if you're in a county or in a state that is really thinking about wanting to embark on this process, the partnership of the national perspective from Millie and FREDLA in combination with the state and local perspectives of really getting diverse stakeholder groups to be involved was invaluable. I think this is why we were able to produce such great quality documents, because we had a number of voices at the table that represented such important groups that had expertise and needed to be at the table. So this allowed us to have rich and meaningful conversations about the needs of our state, the needs of our families, the needs of our youth, in order to make the best recommendations to meet the needs of our families. And then we were also able to learn from Millie, one, what is the best practice? What is nationally the best practice? And what's going on in other states? So this really allowed us to have really great information and be able to have informed discussions and informed decision making as we were putting these manuals together. So some additional lessons learned, again, like anything else, it's essential that this process and the recommended manuals were informed by those that were doing the work. Those people that are doing the work, that are parent peer supporters, that are family peer supporters throughout the state, they are the experts. They're working with the families. They know what's working. They know what's not working. And one of the things that we felt was really successful was that some of this work had been in process for years, but folks were feeling like they were kind of spinning their wheels and doing this work and not making progress. So some of those questions that we got at the beginning were kind of like, we feel like we've been doing this for years. What's going to be different about the process this time? And I think much of what we've talked about is what was different, is that we had all of the voices at the table. We really worked to get the buy-in. We had state folks involved. We had FREDLA and national folks involved. We had local, county, and different representatives from across the state involved that really had a vested interest in pushing and moving this forward. And so we feel really accomplished that this work had been going on for so long with so many people doing such great work, but because of the process in place and having a facilitator, having a plan, and having kind of a set steps of what we were doing, we were able to develop all 3 of these draft manuals from start to finish in just 4 months. And then, really a part that we want to continue to focus on is engaging in conversations and advocacy for the role, making sure that we're emphasizing these outcomes for kids and families, and really thinking about how can we continue to advocate for different types of funding sources.
Thank you to all of our wonderful speakers today, to Randi, to Wren, to Wanda, for sharing your experiences in establishing standards for this critical workforce. And the services and supports that they provide to families in your state, and really contributing to learning about the workforce nationally and strengthening our work with them. There are a number of resources on the slides that we hope you find helpful. But if you have any questions or want to learn more, please feel free to reach out to any of the presenters today, to the Training Institute staff, to FREDLA, to the TA network. We're here to support you in doing this work where you live. So thank you and have a great summer.